Hello.
Hello.
Welcome to
So one,
Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today I have Dr. Sokolina with me. She is here to discuss practical sleep solutions. Dr. Sokolina, founder and CEO of Harmony Dental Arts, is dedicated to promoting sound sleep and healthy breathing. A Russian immigrant, she graduated from medical school with her dental degree and earned her DDS from New York University College of Dentistry. With expertise in implants, cosmetic dentistry, full mouth rehabilitation, and orthodontics, Dr. Sokolina is also involved in dental sleep medicine, focusing on innovative solutions for sleep apnea. She hosts a Facebook group and a YouTube channel dedicated to sleep and breathing. Through interviews with professionals and patients, these platforms foster a supportive community for those with sleep-breathing disorders. A sought-after speaker and diplomat of the American Academy of Dental Sleep Medicine, Dr. Sokolina has served on its boards and TICs. She shares knowledge through lectures and articles for both general and medical audiences. Her work has been published in prestigious outlets like Forbes, AARP, and Sleep Review. Welcome, Dr. Sokolina.
thank you very much for such a generous introduction, Kayla. I'm so pleased to be here. And the people with, neurodivergent people, I have a lot of them in my practice, and I'm very passionate about helping. It's sometimes requires some experience to, I would say, to change a regular trajectory, but I do understand sensitivity issues and setting up the routine, and I'm going to share it with your audience.
Please introduce yourself.
I think you already said a lot of things about me. So I'm a general dentist, and I do have a lot of expertise in treating kids or, regular people with general dentistry, periodontal disease, cavities, aesthetic dentistry. But 15 years ago, I became very passionate about sleep because a lot of people in our time, they don't sleep well. And I tried, and myself included, I totally can relate to those, topics, because for me, I have some days that I can count ships, I can do whatever I can, breathing techniques, you name it, and it's still very hard to put me in a relaxed stage. So, that's one of the things. And second thing, a lot of people who cannot sleep well, they grind the teeth. And it's actually a problem for neurodivergent people as well, because they have a muscle response very strong, and they have a tendency to break the teeth. Yeah, so that, we're going to talk a little bit about that. So seeing all of that, I try to find the solution. What dentistry I do would stay in the mouth and not break, but also if I can give them a good ability to breathe at night with airway being open, I hope they're going to become a healthier and happier people during the day. So that's my goal. And just like you mentioned in my introduction, I try to share my knowledge on the social media through my interviews or I interview other practitioners on the different areas of sleep. And if I would be very honored if your audience join my Facebook group or follow me through the YouTube or Instagram or LinkedIn, and I'll try to put it, in a normal way on my background, but I put the addresses, but I hope you can put it after the links after the interview and people can join. And, I would be very honored. And I write for Forbes, and now I'm in the process of writing a book. I think this way it would be much easier for me to convey the message what I want to share with the world.
What are the most common dental challenges neurodivergent individuals face, and how can they be addressed?
One of the common challenges, let's start from the start. Oral hygiene. Oral hygiene, brushing the teeth or flossing the teeth, it's not so easy. And I want to talk a little bit about the routine. I know in the beginning, parents trying to set it up, but in the family, there are a lot of challenges. And sometimes it's very hard to focus on the oral hygiene. But at a certain point, the person have to take control in their hand. And I know feeling of the toothbrush on the teeth sometimes can be overstimulated. So those are my suggestions. If you find what the toothbrush is too hard, you have to order extremely soft brush for yourself. I'm going to talk about adults. Or if you're a parent, you use gauze with the finger to brush the teeth in the beginning, and slowly with the softest, maybe even it's going to be made of rubber. And sometimes, toothbrushes for kids can be, fit on the finger of adult and have a very soft bristles. Because I think for neurodivergent child, it's very important to convey the message, but it's not going to hurt. It's not going to be too much. And it's going to be the routine. It's going to happen in the morning after the breakfast or before the breakfast and before you go to bed. So that's number one. Second, if you move to regular, mechanical, very soft brush, that would be very helpful. But regarding the toothpaste, a lot of neurodivergent people, they don't like the smells or the taste of the toothpaste. But now, luckily, there are a lot of toothpaste with a very minimal smell or taste. They are not going to be standard toothpaste like Colgate or Sensodyne, but there are some companies what produce a special toothpaste, what it's so much easier for neurodivergent people to accept. And it's not so thick. It's more like a jello, like a very, soft, and it doesn't have a smell and it doesn't have a taste. So I think if you doing it for yourself, using a soft brush and a very, minimally, intrusive toothpaste, that would be key to success. This, as a dentist, we always want people to floss. And I know sometimes with the dexterity, it can be the challenge. But there are flosses what look like, I don't know, they can look like a dinosaurs. They look like, that shape and the floss. So it's not so difficult to hold and just go in between. And you have to do the best you can. And that's going to be enough. Just do the best you can. And that's it. And dentist, and yes, visiting the dentist. Now I want to talk about the other part of that journey. Visiting the dentist every 3 months would be great. If it's not possible, then every 6 months. And I understand it has to be certain relationship with the dental office. And let's say you just move to the new area. You don't know the area. So the best thing to call the office and said, can I visit you? Just visit you. I have my challenges. I want to be familiar with the atmosphere. And after you visit the practice, if you find what they understand you or they can they have a desire to help you, then that's going to be your practice. And you also have to work with the dental professional, maybe hygienist or the dentist. Not everything can be done at once. And I know neurodivergent people are very sensitive to the light. They hate the light, so they just have to mention no light. It can be done without that big light what upset, your vision or your eyes. So, doing the best you can and slowly getting, further. I think that would be a great steps with oral care for neurodivergent people. But just
I
doing
have
it on the
swallowing
regular.
disorder, gag reflex, and TMJ that affects teeth brushing.
So for TMJ disorder, if you cannot open your mouth, there are some brushes, soft brushes, what has a very, very tiny size, and you don't have to open much. And TMJ disorder, and it's very common with neurodivergent people because they have such a strong, I don't know, I can call it muscle reflexes, or I can call it, that position of holding teeth together. I don't know how to define it, but they have a tendency to, to clench.
Yeah.
And for that, if you can wear the guard, that would really help. No,
I
so
have swallowing disorder.
swallowing disorder, and probably for that, it's very difficult to have standard cleaning with a machine, but the dentist can also use the floss. The dentist can use hand instruments, but you don't have to swallow much. And dentist can suction it with the suction. So I think in that case, the understanding relationship between patient and a dentist, that's the key.
Gag reflex.
Gag reflex. Gag reflex, it happens in certain areas, like if dentists touch certain areas. For the gag reflex, it's very challenging to take individual x-rays. But most of the dental practices and hospitals always equip with one machine what check from, what going from outside. We take panoramic x-ray. So for that, gag reflex not going to be involved. But I have a lot of people in my practice with the gag reflex. And number one, you can work on gag reflex and desensitize. If you're willing, if you have a desire to change it, you can yourself try to touch that area with a Q-tip, and eventually it's going to get better. We do that with myofunctional therapy, trying to desensitize those areas. But in the same time, if you have that gag reflex, you can raise your hand, like, okay, don't touch the area, like raise your hand, and dentists have to avoid, touching. It has to be done. It's like a dance. You have to dance.
How does sleep apnea or bruxism impact neurodivergent individuals, and what signs should be looked for?
Yeah, it's a very common problem. I have a lot of neurodivergent individuals with that problem. A lot of them, due to anatomical or physiological reason, they have a sleep apnea. And they have TMJ disorder together. So it goes hand in hand. And standard treatment is a CPAP machine, but that's very challenging treatment for neurodivergent individual because it's covering the face. So they cannot do that. And they get referred to my practice for oral appliance. I'm going to show oral appliance on a screen. It looks like the guard. Remember, we talk about the guard. I highly believe for neurodivergent individual, it's a good way to control temporomandibular joint because it's very hard to not to clench. And it moves the jaw forward, and neurodivergent people can breathe through the night. And just like any other people, it can be a challenge, but if you have a desire to make it work, together with your health professional, you try to make it work.
I have saliva always.
True, saliva always, especially when you have, and we all have saliva always, but when you put something new in your mouth, it's going to be much more saliva. But it's for everyone. It's not, for you specifically or for me specifically. Everyone, if we put something new, the brain perceive it as a food. And that's why we have saliva. You just have to wear it. It's going to be not fun in the beginning, but like any treatment, like look at you overcome so many challenges. So you can do that if it's necessary.
What are some effective strategies for reducing nighttime anxiety and jaw tension to improve sleep quality?
This is a wonderful question. And that's what I talk about with my neurodivergent people, in the practice. I highly believe that anxiety, yes, it's part of life, and maybe for everyone, part of life. We have a tendency, what make anxiety worse is a mouth breathing. Once person start doing anxiety happen, it's a physiological effect because anxiety resides here in the chest. And when we do breathe with the mouth, we kind of stimulate it. So any person, including your audience or any audience, have to set up a special time before bed to breathe. I have a suggestion, I have a certain tool to suggest. It's called Breathing Buddha. That's a toy you can buy on Amazon, like maybe $20. So it's a toy but change the color, and it set up a certain rhythm how you breathe. We all have a tendency to breathe very fast. We always put ourselves in that fight or flight response with the breathing. Like, and then we stimulate, that anxiety, racing thoughts, you name it. So setting up time to breathe, that's the tip number one. So you want to take a breath, hold it, take a breath on 4, like count to 4. No, not opening the mouth. Try to keep the mouth closed, just with the nose. And we're going to talk about the nose in a moment. So hold it, count to 4, then hold it on 4. And you notice the Buddha going to change the color if you set it up on certain regimen. And then release it on 4, release the air on 4. And then before you take a breath, count to 4. We call it box breathing. And you notice once you do that box breathing several times, you become so focused on the breathing. We usually don't think about the breathing, but you set up time to breathe. So, in the beginning, you breathe with Buddha. Buddha has several regimens. You can, make it even longer, up to 8, and then release on, longer it take time to release the air, calmer you're going to become. But a lot of people, neurodivergent or not, have a difficulties breathing with the nose. So now it's going to be difficult part. And with neurodivergent people, we do it slowly. I suggest to wash the nose. I know, you have a gag reflex, and so if you can wash the nose with a special bottle called nail mat, would be great. But not a lot of people can. So I suggest maybe with a cotton roll or maybe with a Q-tip, you just wash the nose with the warm water. to make sure it doesn't have any flame inside. And you see, okay, can you breathe? Maybe if you can blow your nose, yes, or if it's not possible, you know, some people can, some people cannot blow. And if you can use the bottle, then it would be the best.
Tricky.
Huh?
Tricky.
Itching. Itching? No.
Tricky for me.
Tricky. Oh, no, it's not tricky for you. It's tricky for everyone. But, you know, if it's tricky for you to blow the nose, you can close one nostril and try to get everything out. Close another nostril, try to get everything out. Wash it. You do the best you can. I'm going to show some tricks. If any of your audience can do that, then it's great. This one, open up the nose. It's a little, you know, device, very soft, and it's open up the nose, so it's easier to breathe with the nose. And when it's easier to breathe with the nose, then you become calmer. It's also a lot of neurodivergent people complain on mouth being very dry. I don't know if it's your problem or not, but a lot of people have a very dry mouth. So for them, I recommend the tape. This tape does not cover the mouth, but it's holding the mouth, you know, relatively close. So this is the tape. I don't know if it's visible. And it's stretchable. And you put it around your lips. So your lips are open. But if you open the mouth, it will ask you kind of close it. This way it's going to be easier to set up the nose breathing and, you know, feel better through the night, not to have such a dry mouth and, you know, things like that. And of course, it's a process. It's not going to happen overnight. You have to work on it.
I have a dehumidifier.
And this is great. This is great. But, you know, even with the dehumidifier, if your mouth is constantly open, it's going to get dry. So if you keep it, you know, if you try to keep it closed, just like you do right now, you're going to feel more comfortable.
What are the best food for sleep and for nighttime craving?
Yeah, that's a great question. And I highly recommend to your audience to sign up to my Facebook group and the channel because I'm very passionate about the food. I have a craving at night myself. But the key number one, you have to be prepared in advance. You know, if your family helping you in that or you helping yourself, you know, whatever. So you cannot wake up at night and just start eating cookies. That's not going to help you sleep at all. But what you know, you can be a little bit towards home cooking, or maybe somebody, you know, home cook for you. So Jello from the berries and have it next to your bed in a little, you know, small fridge. So you wake up at night and you eat your Jello. Like you want to eat something at night that does not contain much sugar. Yes, we do crave for something sweet. So we want to eat sweet food, but with a very low hypoglycemic index. So my suggestion, blueberry or blackberry or raspberry. You can do it in the shape of, let's call it sorbet, you know, sorbet or Jello, but have it prepared. Another suggestion would be yogurt, preferably not with a high content of sugar. Or maybe no sugar, but you put the fresh berries in it. You know, things like that. Because cookies or chips, you know, people usually get to that type of food at night, like grab something and eat. That's the bad idea.
Thank you. Dr. Sokolina, for doing this with me.
Of course. Another thing, the banana. Banana is great. Banana contain tryptophan. Like banana, probably the simplest way. You don't have to prepare much. You can just keep your banana maybe in a cut form and you just, get some banana. Banana has a certain chemical to put you to sleep.
Thank you, Dr. Sokolina, for
You're
doing this with me.
very
It
welcome,
was great
Kayla.
to have you on.
Absolutely, it was
Please share
fantastic.
this talk show with your family, friends, students, and colleagues. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.